So today we will be presenting on assignment 3 of evidence-based practice. Our members include Woon Siu Wen, Kelly Tang Kai Ling, Hai Su Jia, Teo Yu Xuan, Hua Wei Ning, Lim Jing Yi, and myself, Tan Rui Ping. So the next slide or introduction. So the topic we have chosen here is chronic mid-portion Achilles tendinopathy. So the Achilles tendon connects the calf muscles to the heel bone. Okay, so this Achilles tendinopathy condition is very commonly seen as a physiotherapist, especially but not limited to athletes. This injury may limit the daily activities of patients, which includes walking, jumping, and running. It is a very difficult condition to treat, therefore we want to expand our knowledge and understand the condition better by doing evidence-based research. Okay, so the purpose of our research is to find interventions that benefit and is cost-effective and suitable for patients with chronic mid-portion Achilles tendinopathy. The goal here is to gain back their normal lifestyle without any pain and essentially improving their quality of life. So the next slide will be on clinical questions. We have two clinical questions here, which includes the first one is, in patients with chronic mid-portion Achilles tendinopathy, does eccentric exercise therapy or night splint and eccentric exercise therapy more effective in increasing the activity of daily livings? So the second question is, in patients with chronic mid-portion Achilles tendinopathy, does shock wave therapy and eccentric exercise therapy or eccentric exercise therapy alone more effective in reducing pain? So those are our clinical questions. And then next we will move on to the next presenter, which is Woon Siu Wen on literature search.
Now I'm going to talk about the literature search. For the literature search, we search for field database to find articles that are able to answer the two clinical questions. The database that we search and able to access for full text articles are the PubMed and British Medical Journal BMJ. We search for two randomized control trial articles, one systematic review and one clinical practice guideline. The first randomized control trial article is named as the additional value of night splint to eccentric exercises in chronic mid-portion Achilles tendinopathy, a randomized control trial. This article is searched from the PubMed database and able to answer the first clinical question. The second randomized control trial is eccentric loading versus eccentric loading plus shock wave therapy for mid-portion Achilles tendinopathy. This article also is searched from the PubMed database and is able to answer the second clinical question. Now I'm going to talk about the next slide. The systematic review is named as which treatment is most effective for patients with Achilles tendinopathy. A living systematic review with network meta-analysis of 29 randomized control trials. This systematic review is searched from the British Medical Journal BMJ database. Then the clinical practice guideline is named as Achilles pain, stiffness, and muscle power deficits, mid-portion Achilles tendinopathy, revision 2018. A clinical practice guideline linked to the International Classification of Functioning, Disability and Health from the Orthopedic section of American Physical Therapy Association. And this clinical practice guideline is searched from the PubMed database. So both the systematic review and the clinical practice guideline have the content that are able to answer the both clinical questions. Now I'm going to talk about the next slide, which is the importance of searching the recommended database. For searching the recommended database, we're able to ensure that the articles that we search are valid and reliable. This is because if we simply search through the web, we may get the articles which are having results that are not reliable and not correct. And for the recommended database, we can believe that the articles published in the database are valid and reliable and can be used as evidence. Then through the recommended database, we also can search articles which is specific to the medical or physiotherapy content, and this able to avoid us from reading through many articles which is not related to the physiotherapy. Then other than that, by using the searching tool of the recommended database, we're able to straight away search for the specific condition, assessment, and also treatment. This is able to help us to reduce the time needed to search for the articles.
Hi, my name is Kelly. I'll be sharing the critical appraisal results of the RCT. This article discusses the additional value of a night sprint to eccentric exercise in chronic mid-portions Achilles tendinopathy. And the VISA-S score, which was the outcome measures tool used in this article, suggested that eccentric exercise alone is enough as night sprint added will not lead to a significantly better outcome. These suggestions can be applied in our clinical questions 1. The critical appraisal tool used to appraise this article was Pedro Skill, and the score for this article is 8/10, which is relatively high and it is trustable. Now, let's look into the strength and weakness of this article. Next slide, please. The strengths of this article are: eligibility criteria were stated, allocations were randomly assigned and concealed, groups were similar at baseline, blinding of all therapies and assessors were made, more than 85% of the subjects' outcome were measured, results between group and measures of the size of the treatment was recorded. On the other hand, the weaknesses are: all subjects were not blinded, and intention to treat was not mentioned for those subjects who have dropped out. Therefore, the validity of the results might be compromised. So, we have to take precautions when extracting the results from this article. However, this article is generally good to refer, as it can be generalized and has sufficient statistical information. Thank you. Now, I'll pass the following sessions to Hazel.
So now I'm going to talk about the systematic review. This article is discussed about which treatment is most effective for patients with Achilles tendinopathy. It is critically appraised to CASP2, and the total score is 9 yes and 1 no. As it was reliable and relevant to read our clinical questions. 10 treatment classes were assigned in this article. It showed that in the mid portion of the Achilles tendinopathy, active treatment seems to be superior to wait and see at 3 months follow-up. In 12 months, there was no evidence for the effectiveness of wait and see. Most active treatment had an uncertain effect in the long term. In addition, this article displayed that there were no trials at low risk of bias. Most of them had an only short follow-up. Other than that, there was large uncertainty in the comparative estimate. So there is no recommendation for any intervention for Achilles tendinopathy. Since there is no real evidence on which active treatment is more effective, they have suggested calf muscle exercise therapy due to its wide availability, which is easy to prescribe, safer, and cheaper. In 3 months follow-up, the article showed the combination of eccentric exercise and shockwave therapy management were more effective than combination of eccentric exercise and night sprint management. So this can answer our 2 clinical questions. Next slide. The strength of this article is the inclusion and exclusion are met. The database used the validated. The author looked for the right type of paper, and it has benefit both the harm and cost. So for the disadvantage, which showing at the PPT. So I'll pass it to the next person, which is Shuja.
Okay, so now I'll be talking about the CPG. Okay, so basically our CPG is critically appraised through the Agri2 instrument, and there are 6 domains. So for domain 1 is 83.33%, domain 2 is 66.67%, domain 3 is 58.85%, domain 4 is 84.72%, domain 5 is the lowest, which is 9.38%, and then domain 6 is 35%. So the overall rating of this CPG is 4/7, and we recommend this CPG to be used with some modification. Okay, so next slide. So the reason is some items in this guideline, although they are stated very clear and very detailed, however, some items and information are still not stated clearly and concisely. That some information are still lacking. So if these unstated or insufficient information can be added or modified, then we will recommend this CPG to be used. Okay, so next slide. Then this CPG has some strengths and weaknesses. So for the strengths are, the overall objectives of the guideline are clearly described, and then the health questions covered by the guideline is also clearly described, and then the target users of the guideline were clearly identifiable, and then the systematic methods used to search for are used to search for evidence, and then the methods for formulating the recommendations are clearly described. A procedure of updating the guideline is provided, and then the different options for management of the condition of health issue are clearly presented, and lastly is key recommendations are easily identifiable. And then this CPG still have some weaknesses, which are the health benefits, side effects, and risks has not been considered in formulating the recommendations. And then the guideline doesn't describe facilitators and barriers to its application, and then the guideline doesn't provide advice and or tools on how the recommendations can be put into our practice, and then the potential resource implications of applying the recommendations have not been considered. The guideline doesn't present the monitoring and auditing criteria, and lastly, the views of funding body have not influenced the content of guideline. Okay, so next slide. So now I'll be talking about the intervention that can use into our practice. Okay, so based on our RCT1, it states that eccentric exercise in combined with night spleen therapy have the same effects when the eccentric exercises are provided alone. And then RCT2 states that the eccentric exercise combined with short wave therapy are better than the eccentric exercise when provided alone. Then in our CPG, it states that the combination of extracorporeal short wave therapy and eccentric exercise, if effective on night spleen alone, is not beneficial for the chronic mid-portion Achilles tendinopathy. And then in our systematic review, it states that combination of eccentric exercise and extracorporeal short wave therapy management has more beneficial compared with the combination of eccentric exercises and night spleen management. So in our management for chronic mid-portion Achilles tendinopathy, we choose the combination of extracorporeal short wave therapy and eccentric exercises as the management. So I will pass to Jingyi.
Okay, so now I will be talking about the interventions that we will recommend for the patients with chronic mid-portion Achilles tendinopathy based on the evidence. And the interventions that we will recommend is the combinations of the eccentric exercise and shortwave diathermy. The total durations of the treatment is 12 weeks. Okay, next slide. During the initial stage of the treatment, the loads given to the patient will only be their body weights. The patient will be instructed to stand with both legs on the surface, slightly higher than the ground with full body weight. The forefoot will be supported on the higher surface, and the hind foot will be suspended in the air. The patient then need to push up their body with the help of the good leg to perform the tip-tops with ankle bandha flexions. Then, lift the good leg off the surface and transfer the whole body weight on the injured leg. Then, the patient need to lower down the injured foot until the heel is lower than the higher surface level and the ankle is in dorsiflexion. During this phase, the calf muscle contracts eccentrically to control dorsiflexion of the foot. The exercise can be performed with knee straight or knee bend to eccentrically load the gastrocnemius muscles and also the soleus muscle respectively. No concentric contraction of the calf muscle are allowed during the exercise. At the beginning of the treatment, the patient can perform this exercise for 3 sets with 10 repetitions and aim to complete 3 sets with 15 repetitions at least twice a day by the second wave of treatment, and we will provide 1 minute rest interval between each set for the patient. The exercise can be progressed by increase the weight around the injured ankle. After, the patient can perform the exercise without any associated pain or discomfort. And we can increase the weight according to the DeLong protocol, which is start with 50% of the 10 repetition maximum of the patient and then progress to 75 repetition 10 repetition maximum, and lastly, progress to 100% of the 10 repetition maximum of the patient. Next slide. Okay, so now I will talk about how we will prescribe the shortwave diathermy on the patients. Okay, so the shortwave diathermy will be prescribed along with the eccentric exercise for 3 sessions of the treatment weekly. A 2000 pulses with a pressure of 3 bar equal to an energy density of 0.1 mJ per mm square, and a frequency of 8 pulses per second will be applied on the patient's skin surface of the mid-portion Achilles tendon with maximum pain and tenderness. The patient will be positioned in prone lying, and ultrasound gel will be applied before applying the shortwave diathermy on the patients. So now I will pass it to
The outcome measure we chosen to evaluate the effectiveness of the intervention on chronic mid-portion Achilles tendinopathy is the Victoria Institute of Sport Assessment Achilles Questionnaire, VISA-A. VISA-A is a self-administered questionnaire-based instrument used to evaluate the clinical severity of the Achilles tendinopathy. Advantages of this questionnaire are: it provides the quantitative index of pain and function in patients with Achilles tendinopathy and can easily be administered in the clinical setting and research. VISA-A is used in the population with Achilles tendinopathy, age range from adolescents to geriatric in both gender. While pregnant or nursing women and individuals with sustained total rupture of Achilles tendon are exclusive. Next, this questionnaire consists of 8 questions that address the domain of pain, function in daily living, and sporting activity. It's used to assess the pain as well as how the Achilles tendinopathy affects the daily activity, functional mobility, gait, and life participation. Besides, it's used to evaluate the effectiveness of the intervention prescribed as well as monitor the progression. However, it is not designed to diagnose the condition. This questionnaire is based on inverted numeric rating scale. From the first to the third questions is related to the domain of pain, 4th to 6th is related to the function, while the last 2 questions are related to the sport activity. Question 1 to 7 are score out of 10 points, while the question 8 are carry maximum of 30 points. In the question 8, it consists of 3 choices which are A, B, and C. The patient only requires to answer either one according to their condition when having the sport activity. If the patient has pain when having sport, he will automatically lose at least 10 marks or even 30 points. The total score is ranged from 0 to 100. Normally, a symptomatically patient is able to score 100 points. According to the Jonas Vestager 2012, the patient who gets score from 0 to 24 would probably be very disabled or having ruptured tendon, which could not be characterized as having the Achilles tendinopathy. Besides, it also states that the patient with a lower score indicate more symptoms and greater limitation in the physical activity. While a recreational person suffering from the Achilles tendinopathy will not score higher than 70 points, as no point will be collected in the question 8 as it related to the condition when having sport. So, in the clinical settings, once the patient reaches 70 points, the doctor will indicate that they have cure from the condition. According to the J.M. Robinson 2001, the VISA-A questionnaire is reliable and has a controlled validity when compared in patients with range of severity of Achilles tendinopathy and control subject. Furthermore, in the VISA-A questionnaire, observer bias had avoided, which can diminish the inter-observer reliability due to it is a self-administered questionnaire and had included a reliable questionnaire, which is the visual analog scale to assess the pain. That's all from us. Thank you.